We are absolutely focused on making a difference and therefore on producing practitioners and producing doctors and largely that make a difference.
Our passion is to demonstrate to students what they learn then defines them as a doctor.
The thing that you're most excited to do when you start medical school is getting some hands-on experience, not just by learning from a textbook, from actually seeing it in person.
We have our students engaged in clinical exposure right from the get-go, so as early as possible, as frequently as possible.
The students are developing those skills which are critical to being a doctor in real-life situations with real-life patients right from week 3 of our programme.
I chose Hull York because I saw problem-based learning as an opportunity not just to learn, but to have access to a wide range of knowledge that most people don't have.
People ask me repeatedly why we do well compared with other medical schools in the UK. It's very hard to believe that problem-based learning isn't part of that story. And the very special thing is that our problem-based learning facilitators are clinicians.
Hull York Medical School is really well networked into NHS organisations and clinical practice, and therefore it gives you ready-made access, and that's a real strength.
It's true experiential learning because you can apply it to the situations you've seen right from day one of your programme. We're delivering the types of doctor that the NHS going forward needs.
Our students are really skilled communicators, and that's the feedback I get from senior doctors in the NHS who work with them as graduates.
The graduates of the programme care about patients. They understand the problems that people face and they're empathetic. They can understand it from the patient's perspective as well as from the doctor's. So I think our programme sets our graduates up to have skills at a level above other medical schools.
We focus not just on knowledge and skills, but also on this whole area of resilience. Developing skills that mean that when you face adversity in the future, you can cope. We have a robust student support system. We're thinking constantly about how to help them develop and how to get over the various barriers they may face.
We produce first-class doctors, and a lot of our effort is around how we can make that even better. And the other way is by doing research that's of relevance to our community.
What we have at Hull York Medical School is obviously a wide range of researchers across both our campuses, all of whom are experts in their field, all of whom are contributing into our programme at a teaching level and offering opportunities for students. To be a good clinician, you've actually got to be a good researcher. So why wouldn't you want to get excited about research as a medical student? We offer the opportunity to develop the skills to be able to do that, as well as the skills on a day-to-day basis to look after people.
The role of a medical school should be to ultimately improve healthcare, raising health awareness and health across the board, dealing with local issues. And if we're getting more and more applications from the local region, then we know we're affecting change.
The fantastic thing about Hull York is that I'm not apprehensive and I'm not scared about going into the workforce. After 5 years, you have experienced so much of it that you're ready to take the next step into your career and really make a difference from day one.
My vision for this medical school is for us to facilitate doctors who are able to deal with people at the most vulnerable points of their lives, to understand that medicine is a privilege and it's a service, it's not a right. Because I think if doctors can do that well, they can do anything well.
There's an opportunity across our footprint to see everything. Learning with clinicians, learning with researchers, and becoming the best possible doctor that you can be.